Welcome to the What's Happening Birmingham video podcast.
Hello, everyone. This is Jarvis S. Scott with What's Happening in Birmingham today. I'm back with my good friend, Birmingham's doctor. That's what I like to call it. Birmingham's doctor, Dr. Jamie Bell.
I love it. Hey, Jarvis, thank you so much for having me on here today. It's always a pleasure to talk with you. I appreciate everything that you're doing for our community. Thank you for having me.
Well, I want to bring Jamie back on to kind of give her thoughts on the status of COVID-19 just nationwide, but also just here in Birmingham. As you all notice, the numbers are been going back up.
They really are.
Yeah, since this grand reopening we have had in Alabama. So, Jamie, what's been your opening thoughts on that so far?
Well, again, thank you for having me. My name is Dr. Jamie Bell. I'm board certified in family medicine. I want to give a disclaimer, like I try to do every time, we talk or I do any kind of interview. Everything we share today comes from me, Dr. Bell. My medical knowledge, my medical professional opinion is not a reflection of my employer at all. This is all coming from me. So that's my disclaimer. Thanks again for having me. I think I've said that so many times. And the reason I say that is because I believe that education is key and that we've got to give people the information and the facts that are out there. We know that we've been in this COVID-19 pandemic for several months now. A lot's happened. Since I know in Alabama, we started the shutdown, so to speak, in March. We know that COVID-19 hit the United States maybe at the end of last year, but especially we know that it hit it at the beginning of this year. In the last month or so, a lot of states have reopened. They've instituted their reopening phase plans. And here we are today at the end of June, and so much has happened in this time. We see numbers right now that are steadily rising. Some states' numbers are higher than they've ever been. Alabama is one of those states. Today, I noticed that in the last 24 hours, the state of Alabama has had 1,100, and I think I wrote it down, 126 new cases of COVID-19 in the last 24 hours. Guys, that's huge. That's the highest number that we've seen this far. So interesting that we're actually talking today, Jarvis, because this is the most that we've seen. We've never hit a plateau. Our numbers have never decreased, and now our numbers are going higher than they've ever been. Our state is pretty much reopened, and it's a lot that needs to happen. It's a lot that I think we can discuss here to get information out to everybody.
All right, and one thing I always like to add to the disclaimer too to Dr. Bell, at the end of the day, y'all, this is just informational. Go see your doctor.
That's right. That's right.
Anything out of this, all this, the health interviews, I want to make you go see your primary care physician. So let's
absolutely
start that off. What's been interesting, I guess, since we last talked is the increase in testing sites.
Right. Right.
What's your thoughts on that, and what should people look for in choosing a testing site to go to, in your opinion?
Yeah. The only way people can know if they have it 100% basically is if they get tested. Like we said before, is that people can be asymptomatic. That means they have no symptoms of COVID-19. They may not have fever, chills, they may not be coughing, they may not be short of breath, but they could still have COVID-19. We are doing more testing. We could still do much more, but we're definitely doing more than we have been. I actually got tested this week. Several sites have different criteria for testing. Some places you have to call and make an appointment. Some places you have to have symptoms before they will allow you to be tested. We know that there's several testing sites that have popped up in our state, in our city. I saw a number on the news this morning. It's 205-975-CV19 for COVID-19. Again, it's 205-975-CV19. We know that UAB has a drive-through testing site. That's actually where I went. You have to have an appointment, and I had to have symptoms, I believe. Well, excuse me, I did not have symptoms, but you had to have a reason to be tested there. I know that Legion Field is doing some testing. I know there are lots of sites. You can also go to the Alabama Department of Public Health website to look for local testing sites in your area as well. And I'll tell you, man, that test is very, very interesting. I ended up having to be tested for possible exposure. Was not in contact with somebody who tested positive, but I had contact with another person, and that person had been around somebody who was positive. So I ended up being tested. I'm a physician, so obviously I need to know because I don't want to give it to anybody else. not even just patients, but family members, friends, the random person that I may walk past in the grocery store. And when they do the testing, some tests, they go into your nose. Some tests, they go into the back of your mouth. Then you have some blood tests. But I know a lot of the rapid tests to know, hey, do I have the virus right now? The viral test, they're doing in the nose and they're doing in the mouth. When they do that nose test, they go very far. It is not like a flu test where they just go up a little bit into your nose. This test is very, very deep. You know, I had to put my head all the way back, and they had to go all the way to the back. It lasts, they say, you know, once they get back there, they count for about 5 seconds after the Q-tip is in place. So it's a pretty extensive test. Some testing sites, you'll know your results in 24 hours. Some testing sites may take 2 to 5 days.
Okay, with that being known, the 2 to 5 days or 24 hours, does that affect any difference on the effectiveness of the test as far as saying you definitely, because if it takes longer, is it saying like you definitely got, whereas it's 24 hours, it's not so 100% accurate?
That's a good question. Not necessarily. It's just probably with where they have, because some places may be able to do testing, like a place like UAB may be more likely to do testing on, you know, at their facility, where other places have to actually send the test off. So it doesn't necessarily mean that if it takes a little bit longer that you are positive. UAB actually told me, they said, you will know your results in 24 hours. So regardless. So I think it's just more of a testing where the test has to actually be shipped to actually be completed.
All right. So it moves on to the next thing, and I'll be remiss not to notice on your face you have your face mask on.
Mask on. Mask on.
Yeah, mask on, mask off, like Future.
Right. Future said mask off on his song, but that was pre-coronavirus. So.
yeah, pre-coronavirus.
That was pre-coronavirus. So we're saying mask on now.
So there's so many different types of face masks out these days. You know, you got the K95, the type that you got on. I don't want to mix up the type. And then you got just the face shield.
Right.
You know, from the best to just, you know, I'm gonna say average. I'm not gonna say best or worst. And the different face coverings now.
Well, I think a lot of us that are in the medical field, especially if you're still actively seeing patients and you're at risk for seeing patients or if you're around patients that have COVID-19 or high risk COVID-19 situations, you're going to wear more protection. For the person who is just non-medical, the person that's just going to the grocery store, that's maybe going, to the pharmacy to get their prescriptions, things like that. Every time you leave your house, you need to wear a mask. That mask, when I say mask, I use that term loosely, but when I say mask, it needs to be a face covering that covers your nose and your mouth, okay? Your nose and your mouth. It doesn't belong up here. It doesn't belong down here. It doesn't just cover your mouth and not your nose. You need to cover all of this because we know these are the main entryways for COVID-19. So mask, that's one of the best ways that we have to protect ourselves right now, especially because we have reopened. You know, states have reopened. People are, going around. They're kind of moving as they please. And that's another reason that we're seeing numbers going up, because I think some of us have gotten a little bit lax and we need to be more diligent about protecting ourselves and protecting others. COVID-19 is here. I don't think it's going anywhere anytime soon. We're in the summer and the numbers are going up. I've heard a lot of people that said, a couple months ago, hey, maybe when the summertime comes, the numbers will go down. Well, we're right here in the middle of the summer. June is here. We're knocking on July. It's hot. It's hot and humid in Alabama, and COVID-19 is rising. So please, please, please wear a mask everywhere you go. Also, we need to encourage people to continue to social distance. These are the best tools that we have to try to prevent this. Washing your hands, still washing your hands for 20 seconds, soap and water. If you don't have soap and water, hand sanitizer that's at least 60% alcohol. But washing your hands, wearing a mask, social distancing are the best tools that we have right now, because this is an invisible enemy. You cannot look at people and tell that they have COVID-19.
Well, and the thing too, I want to go back as well. How long should you keep a mask before you dispose it? That's
a very good question. Me personally, depending upon the activity and the interaction, I'm changing. I'm not wearing the same mask every day. Every day you see me, I have on a new mask. Sometimes I change masks on the weekends when I go to the grocery store, because I'm not wearing an N95 everywhere that I go. You know, I'm wearing it more so when I'm in the clinics, because my clinic is inside of a hospital setting. But, you know, when I'm wearing like this mask right now, this isn't an N95. But it is a medical grade mask, so to speak. It's not a dust mask, but you know, I'm changing these things out. Like on the weekends, if I go to the grocery store, run some errands, I wear it, I throw it away. I'm not going to wear it the next day. A lot of the masks that they have now that I've seen, I was looking at some online because I'm going to purchase some for my child, because I've been putting on these kind of masks on her as well. But they have the ones that are washable. I know Crayola.
Yeah, I was going to ask you that.
I saw Crayola has some. I'm going to look tonight on their site. I'm not endorsing anybody, but I'm just saying I saw that they had some washable. I know some of the stores like Target and have washable masks and things like that. They're different sites. So yeah. So you definitely don't want to be wearing the same mask. And then, you know, just like kind of common sense things, if you see that your mask is visibly dirty, you probably want to get rid of it. Now I will say this, make sure you have a backup too now, because I'd rather you wear a mask that's maybe a day old than to go outside and not wear anything on. I mean, I think we just have to be very cautious.
All right, and the thing too, I guess I want to think about is, I guess people, you know, look in the news and say like the summertime catching up. Do you think that, you know, mass gatherings of people, is that affecting the numbers, or should people be afraid if they go out to outdoor mass gatherings or meetings or events that they may be susceptible to catching?
I think people just have to be smart and make big decisions. If you're going to be, you know, like at the end of the day, you need to be wearing a mask. I'm seeing people gathering like on my ride home from work. I see gatherings of people, nobody's wearing a mask, people aren't social distancing, and that's a problem. We've got to, I know that we sometimes let our guards down and we get a little bit lax, and we've got to remind ourselves. I have to remind myself that I cannot get lax with this thing. You know, I've got to wear my mask, I've got to be cautious. You know, there are times that I've been out, you know, like my neighborhood has food trucks, for example. I've gone to the food trucks and people see me and they want to come up to me and give me a hug. And I have to say, hey, you can't hug me. You know what I mean? Like, I'm terrified of COVID-19. Like, please, you know, no disrespect. You know, you can't hug me. Because we just have to be very cautious about that. One other thing I've been hearing is a lot of people are getting mask shamed, where they're being joked or teased because they're wearing masks. Like, that's not cool. This is like life or death. People are dying. And I think when you if you know somebody who's been personally affected, obviously it hits home a little bit. I've known people to die for this. I've known this has totally changed people and families' lives. So let's be respectful of each other. And let's, you know what I mean? Let's do the best we can to be accountable for ourselves and others. You know, when you go to restaurants, I mean, make sure, you know, you're social distancing. Take some accountability for yourself to make sure that you are social distancing. Even when you're outdoors, you know, when you're outdoors, make sure you social distance.
So before I close, is there any, like, we want to call you like a, what they call, like a, if you was a predictor, or if you was like looking into like a crystal ball, what do you see?
I'm not Nostradamus.
Nostradamus, I wanted to say that. I want to say Nostradamus. If you had to look into, you know, not saying doom and gloom, do you see us, you know, going into this second wave? Is it going to be worse than the first wave? Or do you see, you know, as far as the curve, is the curve going to flatten, or is the curve going to get even more deeper down?
I think that is going to depend largely on all of us. If we continue to do what we've been doing at the rate that we've been doing it, things will get worse. We're seeing it. We're seeing that curve just go up, 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 up. And if we don't stop and take some accountability, each and every one of us, if we don't start wearing our masks, if we don't start social distancing, if we don't start being cautious of the places that we go and the interactions that we have, this will get worse. We are still in the first phase. We have not left the first phase yet. And the United States, by far and large, is the country out of all the countries in the world that has by far more cases than anybody else. You know, we've got way over 2 million cases. I saw a prediction today. Some medical professionals are saying by October the 1st, we will have 180,000 deaths from COVID-19 here in the United States. We're over 120 now, and they're saying that by October, we'll have 180,000 deaths. That's too many deaths.
And then we're going to hit flu season.
And then we're going to go into flu season. And I mean, I think that the way we're going, if we continue going this way, things are going to be catastrophic. So we've got to start now implementing things and being more diligent about protecting ourselves and others.
All right. Well, Jamie, thank you for coming on today as always.
My pleasure. Thank you for having me.
Hopefully we can, when this pandemic is somewhat over, we can get back to some of your passion subjects you like to talk about.
Right. That's right.
Diabetes and, things like that. Because,
well, until then, we're going to keep educating folks about COVID-19. Yeah. We're going to continue to say mask on. We know that masks save lives. So I just want to encourage everybody out there to be safe, be smart, be healthy. And you too, take care of you. Continue blessings to you, my friend.
You too, friend. Thank you so much. Thank you all for watching this video. Please check out What's Happening Birmingham for more videos. And don't forget to subscribe to my YouTube channel. Thank you all again and have a great day. Bye-bye.
Bye.
Thank you for watching the What's Happening Birmingham video podcast. Please check out our website, app, or subscribe to our YouTube channel for the latest videos today.